TMJ, that is temporomandibular joint. It is that joint which is present in front of your ear and connects your lower jaw or the mandible to your skull. Yes, your lower jaw is free moving, and it is only because of this joint that you're able to open and close your mouth, speak, eat, and do all the activities that you're doing with your mouth. So, if you're having pain in this joint or somewhere in the area around this joint, then you're watching the right video. In today's video, we will be knowing what can be the reason or the cause for this, then what are the symptoms, on how can you guess that you are suffering from this joint pain only and distinguish that it is not tooth or earache, and at last at home remedies of what can you do to get a relief. So come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah to get tips and tricks on dental health and issues.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, as we are speaking about this TMJ joint, let us know what can be the reasons of or what are the cause of you suffering from this joint pain or the symptoms I'll be telling. So the first one is the most commonly seen, that is trauma or injury to this joint. It can be because of any and everything, that is not only from the outside blow, but it can also be because of biting on something very hard, opening up some bottles, etc. things. You can injure or also cause fracture in these joints. Just like as you do it to your other bones, this bone and this joint can also fracture up and they can swell up. So as coming to the swelling thing, the next point goes arthritis. It is nothing but inflammation of the jaw or inflammation of the bones. So in this arthritis, with this inflammation or swelling, there will be difficulty in opening and closing of the mouth. Now the third one that comes up is erosion of the joint. As something gets inflamed, something gets eroded also. So if there is deflattening or erosion of this joint, then also there might be some clicking popping sound that you can hear, and there might be pain. So the next one, that is the fourth point, is the habitual grinding or night grinding or clenching of your teeth. So in this condition, what happens is you tend to rub your teeth on each other. This leads to flattening of the teeth surfaces and decrease in the height of the teeth. And what happens in result is your jaw has to close more so that your teeth occlude or stay onto each other. Does that really matter? How much mm or how much centimeters of change that would be? But if you notice it, even a small piece of some seed or some XYZ food particle, even if it is stuck there between your two teeth, what happens? Yes, you can easily notice it because you are not able to close your mouth properly. So in similar way, your mouth has that registered position in which you are able to close your mouth, or it is, so your mouth has that registered. So in this way, your brain has that registered position in which you are supposed to close your mouth. The position of the jaw, everything is fixed. If there is some change in this, what will happen? The muscles have to strain more, the joint has to work more. And every day if it has to work more, it will lead to straining of it. So this can lead to the TMJ problems. Then next, it is in general, if I speak of stress, then poor diet, lack of sleep, all these conditions also do lead to TMJ problems and TMJ diseases. Then there are some developmental defects also, like at birth only you have been having certain defects of the both side joints are not equal, one is big, one is small, both are small, not fitting in properly, etc, etc, etc. All these things basically lead to your TMJ problems. Now how to exactly diagnose this problem? So what are the symptoms that you can notice? The first, pain. Of course, there is pain here, in the ear, neck, and in the face in the head region. So you can find this pain radiating, and it is quiet paining when you open and close that jaw. The second, stiffness in the jaw. it has become so stiff that you cannot open your mouth properly. Now what is a normal mouth opening is that your 3 or 4 fingers properly fit into that jaw when you completely open it. If that is there, then you are not suffering from stiffness and your opening and closing of jaw is just perfect. The next is you can hear some clicking popping sounds. That is when you place your 2 fingers here and try to open and close your jaw, you can silently hear some tuck 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 kind of sound in there. Like, you cannot hear that because I'm not suffering from it. But if I have been suffering from it, you could definitely hear that click sound there. Then there is limited movement of your jaw that has been noticed. Your jaw cannot properly open and close. Chewing really becomes disturbant. Then there is some deviation or deflection seen in the movement. The alignment of the teeth or the jaw is seen to be changed in many cases. Then there is also locking of the jaw. That is, you cannot open only your jaw. It has been locked in one position. And trust me, that this pain is very much severe. There is one trick in which you can push that joint behind into its original position and relieve the front person or yourself from this locking. But you have to properly diagnose and get it known from your dentist on how can you push that joint. These were the symptoms on how can you diagnose your TMJ problems. Now how to distinguish it from the ear or teeth aches, that is, the pain is radiating. If it is toothache, it is not one single tooth that has been paining, it is a complete lower jaw or complete upper jaw, only one side which is completely paining. If it is earache, then you definitely need to visit your ENT surgeon to distinguish that pains. And also the symptoms that I have told you, you can feel it here and not inside your ear, but it is quite difficult to distinguish for yourself. So it is better you visit your ENT surgeon and a dentist together to know what exactly the reason might be for your this pain or joint problems. So now coming to the treatment, what can be done at home to prevent or to reduce this jaw pain? Now TMJ problems can very minorly occur and this home remedies can really help you to get relief. Many times you don't need any extensive treatments and this at home remedies are going to do much more better. So now as it is a joint problem, you need to apply ice packs. So wherever there is some pain, swelling, etc. things, you apply ice and it is going to relieve. Make sure you don't apply heat because if there is some swelling, then it might just flare up. So apply ice packs. Second, eat soft diet for the days when you are having this joint problems because harder the food, chewy the food, more strain on the joint and more it will pain. The next is take less stress, relax in your life and do not worry about things because stress is one of the new upcoming reasons for your TMJ problems. Eat proper diet, take good sleep. This is how it is going to help out. If you are having more pain, then certain medications which are muscle relaxants and painkillers can together work on these joints. Then the next is physiotherapy. With the help of a physiotherapist, you can have this jaw movement exercises on which and how can you work on it. Then the next is limiting your jaw movement for certain days. Then your physiotherapist might help you and give you some bands or some controlling agents which can hold your jaw in the position. Next is corrective dental treatments in which the alignment of the jaw is corrected, the bite is got into the right position or the height of the teeth is increased in the cases of grinding and clenching. So all these corrective dental procedures can be taken up with the help of a dentist. And the last resort for this, which is not at home remedy of course, along with the corrective dental treatment, this one is surgery. The very rare cases you will need it, but in certain people, yes, you need to opt for it. A dentist is the right person to go and take the advice from for this TMJ issues. If you are having any questions related to your TMJ problems, mention it here in the comment section below. Do not forget to like, comment, share and subscribe to my channel Dr. Mansi Shah. Till then, wishing you a very happy and a healthy smile. Stay fit and be over fit. Thank you.